Welcome, everyone. Thank you for coming. I'm Dr. Pam Schaff, and I'm the director of the Humanities, Ethics, Art, and Law program. And for any of you who haven't been here before, first-year students perhaps, welcome. This is our first art event of the academic year, and our mission is to align the work of patient artists with the core medical school curriculum and to foster enhanced understanding between patients and future healthcare professionals. Ted Meyer is our artist in residence, beginning his third year with us. And Dr. Enrique Ostrzega is the Year 2 Cardiovascular System Chair and extraordinary teacher of cardiovascular medicine, and he's going to join us in conversation with our artist. So with that...
Okay. Before I introduce Alexi here, I always start with a couple facts and see if you guys know what you're in for here. So... take a guess. How many coronary bypasses a year in the United States? Who's got a guess? How much?
300,000.
Keep going. 500,000. So if this is your specialty, you definitely have work. How many heart transplants? 3,200 transplants. And valve replacements? 132,000 valve replacements. Let's give these guys a second. All right. Well, I will introduce Alexi. So Alexi and I have done art together on and off for about 17 years. We've done projects. She also happens to be from my hometown in New York. And she had a heart operation when she was about 4 years old. So we're going to start with her, and she will tell you about her procedure, and then you are going to talk to us about the difference in the way she was treated and how you would treat the same thing now, and then talk a little bit so these guys know about advances and just, cutting people open and holding their hearts.
Okay, so hi. Thank you all for letting me be here today. So I was born in 1969, and when I was born they found a murmur in my heart. I have bills on the wall that I did drawings, and according to the bills, I had my first, consultation at 3 months old, and they diagnosed me with PDA, Patent Ductus Arteriosis, and please correct me if I do any of this incorrectly. So that is a duct that connects your aorta with your pulmonary artery. When you're in utero, you're obviously not using your lungs to breathe, you're getting your oxygen from your mother's blood system. So that little connector is working, with the blood system, with the good air, with the oxygenated blood, deoxygenated blood. And when you're born, that little duct is supposed to shut, and mine didn't shut. So they the blood was going through, and they could kind of hear like a little ocean, going through. So from what I understood when I was a child was that I wasn't compromised. So they were saying, oh, it'll probably just close up on its own, or I was told later that they waited till I was 4 because I was still young enough to not be scared, but old enough to handle the surgery. So I went in, it was October, and the surgery was 2 days later. I was in the hospital for 13 days. My incision went from the middle of my back to the middle of my chest. From, again, stories I've been told, your ribs are very soft. They were able to open up the ribs and do the surgery and put them back. I remember being extremely sore and not being able to breathe really deeply when I woke up from the surgery. Prior to the surgery, they had to see how the blood was flowing through my heart. So I have a scar right here. There's a drawing of it on one of the bills. I believe it's called a I can't read it from here now. Andrew?
Catheterization.
Okay. So they cut me open. I was awake for this. So 4 years old, in this dark room, tied my hand to the metal part of the bed, cut me open, shot this dye up my vein that felt like fire going up my vein into my heart, crying, throwing up. The nurse going, look at the screen, that's your heart, and this purple blobby thing, and kind of seeing the dye go through. So that was a really vivid memory. And afterwards, being in the hospital 2 weeks, I just had all these visual memories from being there, which are documented in this show. I was there in October. We trick-or-treated at the nurse's station and got Band-Aids. I remember very, very vividly being in the playroom area and wanting to paint. There's memories of that. There was a little like fake kitchen thing set up for kids to play with in this bowl of wooden oranges. And I remember after the surgery going there and picking up these 2 oranges and just fainting from the surgery afterwards. Having 2 different roommates, people visiting me, just very, very strong memories. Having this really wonderful, there was one nurse that I really loved. And you have to explain this to me because this is how I remember it. And it doesn't really make sense. I would get the hiccups. And for some reason, if I got the hiccups, they would not want you to hiccup because of the incision. And so anytime I was hiccuping, I knew that they were going to stick this tube down my throat, and I got freaked out, and I would cover it up. And only this one nurse that had these, it was the 70s, so she had 2 blonde braids, would come over, and she was the only one I would allow to put the tube down my throat to stop my hiccuping. And she would say, the white gloves or the green gloves, and I would pick, and then I would let her do that. Why would they do that? Like, is that I never understood that.
Well, I will assume from what you are saying, they were trying in the immediate post-operative period to prevent you of having any complication, and because you had a big incision surgery, every time you did some unusual type of breathing, coughing or hiccup, it could have caused not only more pain, but could cause sometimes some problem even within the lungs. So they were trying just to avoid this.
And putting a tube down my throat stopped the hiccups?
Well, I don't know. There are some popular type of things to do to try to avoid hiccup that work more or less than any other treatment that we do.
So now, how would that... Let's talk about the advancements. So from when she had this done, now a much smaller incision, would you have to cut her open? What?
Yeah, okay. So good afternoon. Let me introduce myself very quick, although I'm Enrique Ostrzega. I'm a cardiologist here at USC, and I happen to be involved with education as chair of the cardiovascular organ system that is going on just now. It's the 2nd week. So just by show of hands, so I know who is the audience, how many are 2nd-year medical students? So a good person, 1st year, no, probably, and then other colleagues or visitors. Let me give a little bit of maybe medical because it's part of the system and they are here. So what Alexa, can I call you Alexa? What she had is what is called in general terms in cardiovascular medicine a congenital heart problem. This is part of what is called congenital heart disease. So it's a heart condition from birth. It's called PDA, stands for Patent Ductus Arteriosus. And so we'll explain very quick what is it. First of all, that lucky, a condition that was diagnosed very early on, was taken care, and I will assume, I don't know the rest of your life, that you are completely fine, and I'm very sure that your doctors told you that for any practical purpose, once this was diagnosed and treated the way it was at your age, you were comparable to any other kid without this disease. So this is the good news, that there are some diseases that depending at what time in life they are being diagnosed and treated and how the treatment works, that doesn't have any impact in the rest of your life. It has had a very positive impact for you in terms of your art development, where I can see a lot of your art evolves around your experience with this medical condition. As for the medical condition itself, so it's called Patent Ductus Arteriosus for the medical students. It's a very interesting part of the system during the fetal life. So when the fetus is being formed, there is something in terms of cardiovascular system that we call the fetal circulation, which is somewhat different than the circulation once the baby is born. And one of the big things that are different is that there are 3 big structures in fetal circulation that are not going to take part on the adult circulation. One of these structures is called the ductus or ductus arteriosus. And basically the entire thing, without going a lot into details and to keep it as a general level, is that you need to think that in fetal life, the lungs of the fetus are not functioning in the way they will function in an adult, in a born individual, with the function of exchange of oxygen and CO2. So who is doing this for the fetus that is alive and needs to breathe and needs to have oxygen for the body? So this is taking place in the placenta of the mother. So what happens is the placenta in the mother, through some conducts that are called the umbilical vein and umbilical arteries, they go through the umbilicus of the fetus into the circulation of the fetus. And so what happens is something like this. The oxygenated blood, the blood with oxygen that comes from the placenta of the mother into the fetus, it goes through veins that are called the umbilical veins that are bringing a lot of oxygen. And the entire idea is that the most oxygenated blood in the fetus needs to go to the organs that need it the most, the heart, the brain. And so how does it get there, this oxygenated blood? So it goes first, bypasses already some of the other structures through something that is called the ductus venosus. So there is a ductus arteriosus and there is a ductus venosus. It's a structure that bypasses the liver. And then this highly oxygenated blood gets into the heart, this 4-chamber hollow muscle. And it gets through the right side of the heart. The right side of the heart in normal adult individuals is the part that handles all the blood that comes from the body after the body has used the oxygen. So the blood that is more dirty with less oxygen comes back to the right side of the heart. And from there, through different structures, is going to go to the lungs, through the pulmonary artery. In the lungs, this blood will get rid of the CO2 and will get oxygen. So now the blood with more oxygen will come to the left side of the heart and from there to the rest of the body. That's the normal circulation. In the fetus, the blood that was coming with a lot of oxygen came to the right side of the heart. And so through some special connection, it got from the right to the left without going through the normal conduit. So for example, it gets to the right atria, and from the right atria there is also a hole that is called the foramen ovale that connects the right atrium to the left atrium. So now you have oxygenated blood that goes directly or preferentially from the right atrium to the left atrium through a hole. The left atrium then goes to the left ventricle and to the aorta. So now you have the highly oxygenated blood going to the aorta, to the coronary arteries, to the heart, to the brain. So one mission accomplished. Highly oxygenated blood went there. So now let's keep going. Once the brain in the upper part of the body has used this oxygen, the blood that comes more dirty with less oxygen is coming back again to the heart. So it's coming to the right side of the heart, but now it's interesting, preferentially, it is going to go from the right atrium to the right ventricle. All this is the blue blood. Mm-hmm. From the right ventricle to the pulmonary artery towards the lungs, but the lungs are collapsed. So where does this blood goes? Goes from the pulmonary artery through the ductus arteriosus into the aorta. So the aorta takes the initial part, highly oxygenated blood to the brain, but the lower part, through the blood that comes from the pulmonary artery, gets blood that is more dirty to the rest of the body that doesn't need such oxygenated blood. And then again the circuit continues. This dirty blood goes through the umbilical arteries to the placenta and then gets oxygenated and everything goes again. So the role of the ductus in fetal life is fundamental, to take this deoxygenated blood to get back to the placenta. So then what happens? Why you ended up with the patent ductus arteriosus? Because what happened at the moment of life when the fetus is born, so through different processes, take the deep breath, and then the lungs will expand, and suddenly a lot of changes happen. So one of the big things that happen is that the resistance in the lungs goes down so that it can accommodate all the blood. And so now all the blood that was coming from the pulmonary artery in the fetus and was deviated through the ductus now can go through the lungs. So now the blood goes to the lungs will oxygenate, it will come back, and it will go the normal way. So what happened with the ductus? The ductus is not needed anymore, so the ductus is supposed to close. And so this is one of the things that happen in the transition from fetal life to an individual that is born. When this process doesn't take place from different reasons and the ductus doesn't close, it remains open. The remaining of the open ductus, the name for this condition is called patent ductus arteriosus. It's patent instead of being closed. And now if you keep going down, you say, what happened to this ductus that you had when you were born and didn't close? So people that have it open, then there is now a problem in the circulation. And the problem is what we call a shunt, meaning that there will be mixing of circulation from chambers of the heart. Eventually, when this is not discovered on time, or if it is complicated, associated to other problems, this condition can be of different significance. In your case, and in the majority of cases, it's something that luckily can be diagnosed early on. Once it is diagnosed, because it's something that can cause problem, so one needs to close it. And addressing now, after a long story, how you close it today, so the big advances today in cardiovascular medicine and in surgery is that there are a lot of procedures today that can be done non-surgical. And this is also one of them. What you underwent was the classic surgical closure of the ductus. Why did you have this big opening here? Because the ductus is outside the heart. It's not in the chamber. It's a connection between the big vessel of the heart, the aorta, and the pulmonary arteries. That's where this conduit was. So when the surgeons open, they have a vision of this area where the aorta is, and they went there, and they ligated, and they crossed it, and there was no more communication. And you were cured from this point of view. Today there are techniques where my colleagues, I'm not an interventional cardiology, they can go through catheters. That's why it's called catheterization, without the need of opening the chest. So you can go through different blood vessels in the body, and for this particular condition of a ductus, they can go and they can put special closing devices. So they can go through this structure that is not supposed to be open, and they put there a special device that eventually will get clogged, and it will completely close this ductus. So today you have the possibility of doing non-surgical closure of a ductus. The result being, when everything goes okay, the same, and as in your case, luckily I'm happy to know your story, that it was diagnosed early on, treated, and cured. There are not many things in medicine that we can say we cured. This is one of the conditions that in your case is cured, and for any practical purpose, you're lucky not to have other medical problems, you're equal to anyone your age without this disease.
And you got the great scar.
And I got a great scar, which is why I met Ted.
So I want to talk about, for the first year students here, I was a lifelong patient, and that's sort of how I landed up here. So I talk to a lot of other patients, and we have conversations about the fact that we remember doctors specifically that did big procedures on us. So a lot of this artwork is based on something that happened to you when you were 4, but it's still enough of your psyche. So why don't you talk about that and your memories of your doctor, and then when she's done, I want to talk to you about, you know, you might have several patients a week with major things, so maybe you do remember, maybe you don't, but we'll talk about that in a second. Why don't you talk about how this doctor's works in your work, and something that happened so long ago?
So a lot of this work in the show I did in grad school and post-grad school. So a lot of the pieces that you're seeing here are from like 92 to 96. So I was in my 20s. So the memory wasn't as long as it is now. I made some new pieces for the show, the book, and the drawings on the actual hospital bills. All the bills that you see on the wall are from 1969 and 1973. I think you'll be quite amazed at just looking at the prices of things, which was, pretty eye-opening. 13 days in the hospital, heart surgery, total of $3,700. Kind of, this heart surgery itself was $750. So that, that's all completely changed. So the memories, the visual memories were amazing. as you were explaining the whole fetal circulation, when I was starting to think about this experience and creating artwork about it, of course I pulled out Gray's Anatomy. So you can see the Xeroxes that I was using in the pieces here and over here. Actually, those two encaustic pieces right over there, specifically about the fetal circulation that he so eloquently was explaining. So I was looking up and researching what happened to me and trying to understand it and using the Gray's Anatomy and the text, both as imagery and texture. And like I said before, you have really strong visual memories as being a patient. Being in the hospital for 2 weeks, I had 2 different roommates, and one little girl had like a Dorothy Hamill haircut, and I remembered her very much so, and then another little boy, and there were 2 little drawings over there about it, that had an eye patch. I never knew why he had the eye patch, but they were there in the room next to me. The nurse that I was explaining. Also doing research for coming here and looking at all the bills and remembering these doctors' names. Dr. Frank Spencer was my surgeon, and he just passed away on July 23rd. But I had emailed him to tell him about this show, so I'm hoping he knew that this was happening, because he was 92, and he was still affiliated with NYU Langone, still working professor at 92. And my pediatric cardiologist, Dr. Eugenie Doyle, is 96, and she's still connected. As I was doing research for the show, the 2 of them had done a semi-retirement at 82 and 86, and they had a big gala affair at NYU, and they both still have working emails. So, you guys are second year, you could still be involved 50 years later, in your practice. And I so remember Dr. Eugenie Spencer. I mean, I had the surgery in 1973, and I would go see her annually afterwards. And my grandmother was always so impressed that a woman in 1973 was the head of the cardiology, and researching her now, she was the head of it for 40 years at NYU. So the 2 of them were pretty amazing. Working through over 4 years of, I'm an artist, so I do other things also in other media, but specifically focusing on this, and then later on getting married and having a child, and going through that, you think about the fragility of your body and all the things that you go through, and then having a baby and thinking, I remember having my son and then going to my mom, and I was like, how did you deal with me being in the hospital for 13 days and they were cutting me in half? And oh my goodness. And even then, like, they wanted her to leave at night, and she's like, no, I'm sleeping in the chair. Like, I'm not leaving my kid here. And now, it's all about children and their parents, and you keep them together, and you move beds into the room. So that whole idea of treating the patient and keeping them comfortable, or having a child not be scared and letting the mom sleep in the chair next to them, and I think is so important. That one nurse, she was the only one that I would let put that tube down my throat, because she was kind and made a game out of it and let me pick the color of the gloves. And Dr. Doyle, I remember her, when I looked her up on the internet, she's 96, and she still had that same smile that I remembered when I was 4. And I had written these words in my 20s, and I went back and read it, and I had written, she had the nicest smile. So these things that stand out. You guys the doctors are important. Even as patients, that. Like you guys, or even like when you yourself are a patient and you go to a doctor, who's treating you right and who's treating you as a quick kind of thing, So just keep that in mind. I was 4, I'm 49, and this all came back to me. And I was doing these drawings, and I was looking up Dr. Spencer, and he was in the New York Times, and he died, and I wept at my kitchen table that this man at 92, who had a full, fabulous, incredible life, that he died, and I thought, oh my God, like this is like a full circle moment, and I just wept. And I hadn't seen him since 1973, but he was still so important to me, So everything you do matters, really matters.
So she has these great memories, strong memories. I won't say heart operation's great. And she remembers these people specifically. So what can you say to the students about the fact that they see a number of people and making sure they treat them so in a way that 40 years later, they will have good memories of the experience? And are there any specific cases that you have like a really strong memory of specific patients?
Well, yeah, of course. And I think it's so important and so nice that you say what you say, because it only brings everyone the importance of things that you do sometimes routinely, and like anything that you do routine, you begin to lose sometimes the appreciation of how it can impact the life of other individuals. I think like anything, it's not just in medicine, but I happen to think obviously that anything that humans do have an impact on human life. In this particular field in medicine, particularly because probably I think there's no other thing more important for an individual than their health and happiness. And I have actually some other reflection that I wanted to use when I was invited here, and I said to Dr. Schaff that although I want to think of myself that I can paint and I do my painting but for my own. I was thinking, I said I will use the opportunity to ask you as an artist, because it just happened to be the topic of the heart, because you have this experience with your heart and then affected your art. I was thinking suddenly something that is so obvious, but I suddenly thought, if you notice, the heart is probably one of the most representative organs in terms of drawings. Sure. But for what? For what is the heart? How does the general population talk about the heart? Let's talk about the ductus, or the heart as an organ or as a pump. It's like the repository of feelings, love, emotion. And in reality, and that's my question to you, I hate to break it to someone that doesn't know, the heart has absolutely nothing to do with this. The heart has absolutely nothing to do with memory, with feelings, with love. Nevertheless, it's probably the most recognizable sign for these emotions.
But it's capable of being broken.
Right. You could feel it.
Even, and it's interesting that you bring this, because even the concept of the broken heart, in the general population, the use of the term a broken heart is a broken heart in terms of the broken emotions. And there is interesting that you bring this, and I will ask you what both of you as artists think about it. And I was trying to also look into coming into this, where I did some Googling, yes, and Wikipedia, to see where comes this association. How come that the heart end up being this icon associated with all these emotions and love and so forth? Where does it come from? Because at the time that someone did an autopsy, which again was not in the beginning, they would have known how the system functions and what is the role of the brain and so forth. And it's interesting that I was looking, because you told me that this is the fourth in a series, I think, or I don't know what number of this type of organ-associated art exhibition, that there was one where Dr. Chui, the chair of neurology, was here, and I suppose had something to do with the artist with some issues with the neurological condition. But the little I saw, I didn't see the entire, nothing came about emotions or other things. It was more about the connection of the synapses and this. So here we are talking about the heart, in this particular case, because a true medical condition. But it could have been an artist that her or his art is about drawings of the heart in relation to love, correct? Right. Or to emotion. Sure. And so my question is, how come? I know, because today everyone takes it for granted that that's what it is. That's the, how do you call it, Bitmoji? Yes, the Valentine, everything. And so when I was trying to see where it comes from, you need to go back in the era BC. And no one knows for sure because there are no documents, but it appears that the sign that we know today about the heart was the seed of a plant that is no more in existence. And this plant and how from there the heart is absolutely unclear. Even the drawing of this heart, some people interpret that has some features reminding sexual organs both in women and men. Plus the plant from where this seed sign comes had apparently some hormonal type of features that was used to prevent menstrual period in women. So again, if you go, you say, where all these things came from? And apparently it was at the time that they didn't know the function in terms of the brain and the heart. And so it stayed from there forever. And so because it was a humor, the humors in the body, and they thought because they noticed, as you say, broken heart, that when people were emotional, their heart rate was getting faster, so they thought it's the heart, the center of emotion, not knowing that it is the reaction to what the brain does. So if you are in a state of emotion, the brain through the nervous system will make your heart go faster. But I just found very interesting how a situation that has no relation with reality became accepted, and I'm not here to say we are going to have a different sign for love, but because then we will need to do maybe the right hemisphere, and probably this one is better. But it's just, I find it interesting. I say, here you have an artist, and we're talking about the heart. And
so does that put extra pressure on you because the heart has all these things attached to it that a liver doesn't? I mean,
no, I think I actually have the utmost respect for any discipline in medicine. I don't think talking about what organ or not is more important. I don't think I never think in this way. Obviously, there are some organs that have significance in the sense that you cannot be alive without a functioning heart. But remember, some people are alive with a mechanical functioning heart, and they still have love and emotions. So you can have an artificial mechanical heart, and your heart is not there. So what other proof that the heart is not the center of the emotion? But not in terms of importance. No, everything obviously is extremely important in medicine. So I happen to like what I do, like anyone likes what they do.
So you're also, you donated a kidney to somebody.
I did.
And so let's talk about that a little bit. Does that have anything to do with like this second chance you were given, or these operations, or comfort?
Yeah, I think I've always been, I mean, the whole hospital experience, the only time I was scared was when they did this, this test. The rest of the time I was, comfortable, right? I mean, I was 4, and then they said, like, you're too young to know what's going on. But I mean, I felt comfortable. I was never there, like, freaking out and crying. I remember not being scared when I was there. And then I just was, like, obsessively watching operations on TV. They would have that all the time. And again, operations used to be pretty gory, right? Now everything's laparoscopic, so it's not on TV anymore as much. So, but I would watch all that when I was a kid. Also, I had a cousin growing up. Actually, I was my mother's cousin, so he was older, but his mom had chickenpox when she was pregnant, and he was born with defective kidneys, so he had a kidney. She donated a kidney to him when he was a child, and then he had a second procedure. So growing up with him, he was kind of aware of organ donation. And then my husband had lymphoma and needed a stem cell transplant, and that happened 14 years ago. And in 2012, a good friend of mine's wife needed a kidney, and she sent an email through work, like, I need this kidney. She had polycystic kidney disease. And just like instantaneously, I was like, it's going to be me. I don't know why. I think growing up with this cousin with the kidney and watching, donations on TV and having my husband live through this really crazy stem cell transplant, I felt like I had to give back in a way. So I emailed her. I was like, it's going to be me. Yeah, I'll do it. And she was B positive, and I'm B positive, and that's kind of unusual. And all this, we ended up like, they thought we were like long lost sisters because we matched the whole way. So we did the donation on Cinco de Mayo 2012, and it rejected. And it was the first rejection at Cornell in New York in 13 years. And they never understood why.
Margaritas on.
Yeah, we should have had the margaritas. It probably wouldn't have rejected, right? So so that was, needless to say, greatly disappointing and awful. So then she went on dialysis for a year and a half, and then about a year and a half later, her neighbor, after watching her go through all this, said she would donate, but then she didn't match her, so she ended up donating in her name, and that turned into, I think, like a 7-state, 9-person donation cycle, which was amazing. And now she's great. I'm very comfortable with the body, obviously. I'm comfortable with doctors. I'm fascinated by everything medical. But I was not good at science. So but it was also, I think, more the visual of it all, you know? I think if I was I think I would want to be a surgeon. I think it's fascinating, you know, to do all that. So yeah, I think having this when I was 4, you know, greatly impacted me, you know? I think the experiences you have when you're young kind of feed like a lane that you follow. You know, my parents were both artists, so that was a lane that was like just so accepted in my house, to be creative and visually creative and to have that as an expression. So that was just always exposed to me. And then to be in the hospital young and to watch all this. So, and then having my husband go through a long, you know, almost 20 years of illness and treatment off and on. I felt comfortable. Of course you're scared, but it didn't feel foreign to me. Like walking into a doctor's office or walking to a hospital doesn't feel like a strange place to me. I'm not saying I understand any of it, but it's not like another planet. Like I trust you. I trust you guys, you know, and I think that's a good thing because I had a good experience when I was young.
So for these guys, what do they have to look forward to with all these advances? I mean, you started at a period where they were probably doing this sort of operation, and now you're down to laparoscopic. What if they choose this as a specialty? What do they have in front of them, and why did you choose this specialty as opposed to the liver, which you don't mock?
Well, two different questions. If it's the personal question about my personal, without going in a lot of details, I was not one of these kids that knew what he wanted to do when he will grow up. No, I know there are people that when they are 5-year-old, they say, I'm going to be this, I want to do this. I didn't know. At the time, I think there were some professions that people look after if you were going to study and to go. And it just turned out in my case that I have one sister that she was in medicine, and so probably this was an influence. So I will not make a story that is not real for me. That's how I began. I like what I saw what she was doing. It was hard work, like students know, like any other endeavor in life. But once I got into the profession, yes, I learned I like it a lot. I think the thing that personally I like the most is the ability to have a positive impact in the health of fellow human beings. I feel this very important. You asked before if you remember, of course you remember. I will not say that you can remember the thousands or tens of thousands of patients that you go through, but one way or another you always will recall, and it's a two-way street. I mean, you try to do the best and patients help you hopefully to be the best, no question. Students, we always say for students, you learn with the patients. Mm-hmm. And that's why you always need to be grateful to the patient, because that's where the source of learning. And obviously depends a lot on many other factors of an individual, what makes you develop the right ethics and the right moral, and to know that health, and you understand, hopefully, you hope, sometimes you are a little naive, to think that someone in medicine should have an open mind, should understand what is a pigment that gives a different color, or what is a different eye, and to understand the ridiculous concept of racism and other things. But it's going a little beyond, because this will be a little naive. Hopefully I'm not naive enough to understand that, despite the fact that I think that an individual that deals with human body can understand that physical characteristics don't determine who an individual is, but still, unfortunately, this is not true. And there are individuals in our profession, like any other one, that may have what in my view are unaccepted positions. Anyway, this is going a little beyond, but it's also to say, because you say what to tell the students, I think what I will tell the students is that there is more in life than medicine. And maybe that's not what you wanted to hear, but I'm very strong about this. I mean, life is beautiful, I truly believe, not just a movie. And so enjoy it and do the best of it. And medicine is a profession, it's a nice profession like any other thing. like any endeavor in life, not necessarily a profession. Respect your fellow human being, enjoy life, try to help others. Do the best you have with the tool that you are learning at this moment. I think you are lucky to be doing what you are doing now. Hopefully you will end up after the very tough years of learning, and then whatever you will decide to do, because you are saying liver or other, I truly think it's not important in this profession. I think that every field in medicine is absolutely necessary and important. And so I don't think so much is what you are doing, is whatever you do, hopefully you do it right. You try to do the best you can, and with optimism, and you will be okay.
I agree with that.
So if anybody has any questions, I'm going to come around with a mic in a second. Could you talk a little bit about what experience you're trying to portray with your art? And I know you have different little sections here, but maybe let's talk about this one with the scar, and then these over here, and then I'm going to walk around while you're talking.
The triptych behind me, that's just quite literal, right? That's showing the scar with the magenta ink. So like I said, the scar went from here from the middle of my back to the middle of my chest. And then growing up, they should have taken a better look at my grandmother and my mom, because we were quite busty. So my left breast was smaller than my right breast. I had a reduction 2 years ago, so now they match and they're smaller. But I was really busty, so you could see that in the pictures there. So that was what that was about, just literally showing the scar and maybe a little vanity, with that. These pieces here with the Gray's Anatomy copies were just me kind of making my own systems, right? So using the illustrations, and then these also have linoleum block prints, and I was making little carvings of vessels, and some were printed on the top, and then some I had the linoleum piece behind the paper and was doing like a frottage rubbing, and doing that. You could touch my work. And the artist says you could touch everything, so that's kind of so it kind of creates a bumpiness on the paper. And I do a lot of mixed media, and I'm always about the texture. I always kind of like sneak touches when I'm in galleries, so it's okay. You're allowed to touch it. So I was trying to make like what I was visioning like is my own system inside of me, and making kind of like a pattern with that. And growing up, I had 3 sisters, and there was 5 of us in the family, so I always kind of use these divisions of 5 and 3 just as like a compositional way of arranging space. The first one there too, so it has 5 hearts, and then that shape, I was researching all different like hearts, so that was a symbol of a heart from something. I can't remember now because that was 20 years ago, but finding different ways that artists use hearts. These other ones here, later on, I was just thinking about having a child, and the idea of mothering, and the idea of like a life force. And again, like, so you were saying like the heart is the life force, right? So, and I was looking for other symbols of that too. So milk is like a life force, liquid, and so I was using 5 cups, and just also, I think it was all just about connections too. So not just like, I would do all this free writing and thinking about like how your heart is a connector, and then looking at these Gray's Anatomy illustrations and all the veins and the, all the connections, and then like how family is connected and siblings are connected and we're all connected. And so just that idea. So I was using all these visuals of connections, connections in life. Again, like I was saying before, the drawings on the bills. So my grandmother had kept the whole file, and when I was doing this series, she had passed away, and when we cleaned out her desk, I found this whole file from this, 1969 to 73 of all the bills, and I knew I wanted to do something with them, and I just never did. I just never knew what to do. And when this show happened, I literally just did those drawings last week, and they're done with mercurochrome. And so anybody that's my age knows what that is. So mercurochrome was like in your medicine cabinet. It was this little jar, and it was had mercury in it. So in 1998, I found out that the FDA was like, no, we can't use this anymore. Meanwhile, we had it all over ourselves, like growing up. So and it was this orangey colored liquid that was like an antibacterial. So if you fell and had a scraped knee, you took mercurochrome and you put it on your cut, and it took out. It cleaned your cut, but it stained you. It looked almost like a henna tattoo. So like all the kids in the 70s had like cuts and scrapes and mercurochrome stains like all over their bodies. And I still have insomnia. I don't sleep through the night. And I would go into the bathroom as a kid and take the mercurochrome out and draw like all over my legs and all over my arms, because I wanted to have tons of tattoos, which in the 70s, was not mainstream at all. And so I would tattoo myself with the mercurochrome and draw all over myself. And yeah, so then when I had these bills, I was like, and then I was like, oh my God, I still have this mercurochrome, and so I used it to do the drawings. And there's all, again, the visual memories. Like my great aunt came in and brought me these banana taffy lollipops that if I see them today, because they're only like in those places that have like old school candy, it just brings me right back to when she brought them to the hospital. Like that candy is the hospital, and the wooden oranges in a bowl is like, that's the playroom in the hospital. And yeah, so
I have the same thing.
Yeah.
There's a Modigliani print in the emergency room of Norwich Hospital where we grew up, and anytime I see Modigliani,
it brings you back.
I just hate Modigliani
because it was a bad memory. Yeah. The book, which you guys can take off the shelf and look through. So for years, I would, anytime I saw an anatomical heart in a book, a magazine, or a book, or a newspaper, or even an art magazine, if like another artist had used that image, I would tear it out, and I collected that for years. And now, again, with the mainstreaming of tattoos, like anatomical hearts are just like everywhere, right? Like every pin and t-shirt has them. But before that, you didn't really find them. So I collected them. So if you look through that book, that's just there's 100 heart images that were done, some are medical images, some are actual photographs, and a lot of them are heart images that other artists used in paintings and drawings and sculptures that I would tear out of the magazines. So it just was, to me, like also like more research, like something I was doing, and then seeing how other people were visually depicting this image.
We only have about 5 minutes. Are there any questions for either of our wonderful guests here? All right, we have a question in the back.
So, a great talk. Thanks for presenting your art. And my question is, if you feel talking about it, you said you're comfortable with bodies and medicine, and I was just wondering if you've had this scar since you were a little girl, and I was wondering, when you came of age, did you have any body issues? And if so, is that represented in your art? And did your art help you work through any of those if you had them?
So
Thank you.
It's a funny twofold question. So I remember, I had this big scar, and growing up, my grandmother would say like, oh, she's gonna have to find a really understanding husband. Like, silly, but that's like watch what you say, right? That's kind of a crazy thing to say. Yet my father was a painter, and I've been surrounded by naked women my whole life. Like he always had models and stuff. So, and then going to art school. So I'm and we're European, so we're not prudes the way American. Right? We'd go to nude beaches. Yeah, I grew up we would go to like nude beaches as a family or whatever. So there's that, right? So no, I wasn't. I grew up seeing people of all different shapes and sizes, and so I'm not like vain at all. So yeah, no, I'm not a nudist, but I'm not vain. So no, but it's a good question, because like I teach high school, and I'm a high school art teacher, and that's a huge thing for kids and appearance, right? And especially now with like selfies and Instagram, like everybody's got to be Instagram ready, like at all times, and it's a really big deal. So yeah, so scars, and I think if anything now it's more accepting than ever, right? To show off a scar, which is great. And Ted has this amazing project, which is how we met in the first place, with the scars. But people have, everybody wants to look pretty, right? Men and women. So I think that's something as a doctor that, don't just like, don't be dismissive of how people feel about their appearance,
Okay, we have another question back here.
I was just curious to know if you also did art as a child, and if it helped in any way, or if you had different forms of therapy right after this happened.
So my parents were both artists, and so yeah, we just drew all the time. I didn't have any kind of therapy from this surgery. I never saw a therapist or talked about it. So no, I didn't have anything of that. That is interesting that I could get cut open in half and not have any kind of therapy. It's kind of crazy, but no, I didn't. But we were always able to draw and stuff. So, but like I said, I wasn't scared when I was there. So maybe if I was, and I had scary doctors, or I had a bad experience, or I had nightmares or something, maybe then, but I didn't. So I didn't need it, I guess. So.
Thank you. I'm hoping maybe you might have a little chance to hang around if
Yeah.
people have other questions.
Sure,
But I want to
absolutely.
officially thank you
Thank
for
you.
being here and
Thank
for sharing your story. And Dr. Ostrzega, thank you so much. It was so interesting. And of course, I should expect you would speak not just about the mechanics and physiology of the heart, but about some philosophy as well. So thank you for that. Are there any of the artists who did the work on the back wall here? Some of our students and faculty and staff? So this is work by other members of our community. I just encourage you to take a look. It's beautiful. And to let you know that our next show will be in October, I believe, and it'll be Ted's work.
About scars.
About scars,
Body
right.
image and reconstructive surgery.
Very great. So thank you all for being here. Thanks for your patience about lunch, and feel free to visit and with our artist and with Dr. Ostrzega.
Thank you.